Welcome, ladies and gentlemen. We'll bring to order this preparatory meeting for St. Patrick's Day. Yes, sir. This is a celebration for all you Irish folks out there. So we will convene this meeting. Health Subcommittee. Madam Clerk, please call the roll.
Representative Boyd, Representative Freeman, Representative Hall.
Here.
Representative Jernigan, Representative Kumar. Here. Representative Marsh. Here. Chairman Ramsey.
Here.
Representative Sherrill. Representative Smith. Representative Terry. Here. Chairman, you have a quorum.
Thank you, Ms. Clerk. Do we have any personal orders today besides wishing everybody a happy St. Patrick's Day tomorrow? If none, we will move into our exciting calendar today, and to kick us off, our wonderful leader here, fearless leader. We have a proper motion. Second, item 1, House Joint Resolution 103 by Leader Faison.
Thank you, Mr. Chairman. Good afternoon, committee. Very good to be with you all. Just tell you a brief story. When I was 13 years old, a drunk driver hit the car that my two sisters were in, and my sister just turned 16 the week before, and she had major head trauma from the crash. That was on a Monday. They flew her to the local trauma center, and she lived on life support until Thursday. Through that time, it's an incredibly difficult time for the family. If you've lost somebody that close to you, you know what it means to hurt so bad that you don't know if you're going to breathe. And it was devastating to us. And we noticed early on, because my sister's body was in perfect health except for the head trauma, that a lot of people were very interested in her organs. But we were in the middle of grieving and trying to figure out, is there any chance that she can make it? And they pressed and pressed and pressed for my parents to donate her organs, because she was only alive because of life support, and she had brain damage that was so significant that she would die without it. But in the middle of that, we were just in turmoil, emotional turmoil, and we did not do anything about it. My parents rejected the idea of donating her organs. That happened when I was 13, and all my life I've considered, could we have not done it better? In the last few years of my life, I've personally known people who were on the waiting list for an organ. And in the resolution you have in front of you, you'll see that there's 110,000 Americans currently on the waiting list. And I thought of the pain that I've gone through with my dad's death, my sister's death, and what if there was something that could heal them? Wouldn't that be awesome? And I don't know if you know this, but Tennessee, because of Vanderbilt, it's one of the #1 states in America for organ transplants. We're getting it right. People come in from all over. Last year alone, we had 1,100 organ transplants, and that only came from 390 Tennesseans. So, committee, what I'm trying to do is bring awareness to study now. You don't ever know when this might be something part of your life that you need an organ, somebody you love needs an organ, or what if you die from a tragic accident or something crazy like that, and you have organs that are in perfectly good health that could potentially save another person's life. In my opinion, that's very pro-life of us. So I'm just bringing a resolution, and I'm hoping to get this out in Tennesseans to encourage them, you know what, study this a little bit. Don't wait till you get in the middle of a situation where you're trying to make an emotional decision and you can't make an emotional decision. What if you made it early on? And Tennessee's got it pretty easy. You can just put it on your driver's license if you want to. You can put it in your will. I was just speaking with one of my friends earlier. She's got it in her will that if her organs are healthy, more than welcome to use those to save somebody's life. So that's what this resolution does. Urges Tennesseans to look at this and realize that you can be very pro-life and potentially save somebody's life by becoming an organ donor.
Thank you for that very deeply felt explanation, and we certainly have the deepest sympathy for your family. And I think, Dr. Kumar, you wanted to be recognized.
Thank you, Mr. Chairman, and thank you, Mr. Chairman, for doing this. I think those personal experiences are what make us in life. The experience that you and your family went through is what is making you today. And I think you are a very touching person in the way you communicate, and we appreciate it. I personally would like to say that Chairman Smith, having been a previous cardiac transplant nurse, and myself, having been a previous renal transplant surgeon. I did a fellowship in transplantation a long time ago, 77. And the times I was on call and a tragic situation occurred and the person was brought to the emergency room, going to talk to that family in the middle of their tragedy and asking them to consider donation of organs was one of the most difficult, rewarding, and touching times. You saw grace in face of adversity. And that's what teaches you about life, certainly. And I learned a lot from it. And I think all of us doing everything we can to make things possible for those who are on long waiting lists. And I think the fact that we can sign up for it at the time of our driver's license renewal has also been very helpful and meaningful. I thank you for doing this, and I think we should do everything to encourage people to do so. Thank you, Mr. Chairman.
And thank you, Chair Lady Smith, you're recognized.
Thank you, Mr. Chairman, and thank you, Chairman, for bringing this. As my colleague mentioned, I spent some time at UAB in their cardiac transplant program, and he is right. And because you and I are Christians in the faith, we understand the law of the harvest. And one of the things I learned as a cardiac transplant nurse is our lives are seed. And tomorrow, I'll be going to a celebration of life for a 36-year-old who gave his organs away in Chattanooga. And Cameron Coker, who is one of my family friends' sons, died very unexpectedly. And so to commemorate what he's doing through family, you are absolutely applauded, and I'll be signing on. But thank you again, because we should treat our lives as seed to invest in others, and Tennessee's going to get it right. Thank you, sir.
And thank you. Chair, Leader Faison, you're recognized.
Thank you, Mr. Chairman. And I want to piggyback on what both members just said. And Dr. Kumar said how incredibly difficult it was to go to a family at the time. Sometimes it was rewarding, but that's a difficult. That's why I'm thinking, what if we encourage people to make the decision before you're in the battle? If you make that decision before you're in the middle of such a traumatic time, maybe it wouldn't be as difficult.
Okay, further comments or questions? If not, I would like to say we appreciate your insight. The power of this committee is to look past stigmas and stagnant creativity and try to take care of our citizens in a better manner. So I appreciate that. We'll be voting to send this to full committee. All those in favor say aye. Any opposition? So approved.
Thank you.
Thank you, sir. We'll move on to, I think we have item 2, 3, and 4, House Bill 1350, 231, and 1353 will be rolled. Let's see what, 4 spaces. Let's see, 1, 2, 3. Okay, four spaces. If no objections. Okay. So we have a sign-up, pardon me, we have a sign-up sheet for that resolution that we just heard. If everybody'd like to sign on that. So if there are no objections, we will move these 3 items, 4 spaces, which brings us to item 5, which is House Bill 370 by Leader Cassada. He has determined that he will roll this bill to the final calendar. And at this point, I will make the announcement that our final calendar will be March 30th. All bills on notice by March 24th will be placed on that calendar, and then we will continue to meet until we take care of the business that last calendar generates. We'll move on to item 6, House Bill 1181 by Chairman Rudd. He has taken that off notice. We'll move on to item 7, House Bill, I dread saying it, 666. We have a proper motion and second on the bill, and I think we have an amendment maybe that makes the bill.
That's correct.
If you'd give us the number on that, you're recognized. Have a proper motion and second on the amendment. Do you want to discuss the amendment before we put it on the bill, or just,
The amendment makes the bill.
okay? We'll go ahead and put the amendment on the bill. All those in favor of the amendment, or do you? Yeah, do you have a number on it?
Drafting code is 004568.
Okay, 4568. We will, all those in favor of placing the amendment on the bill, say aye. Any opposition? We're back on the bill as amended. If you'd like to discuss the bill.
Mr. Chairman, members, this simply allows a disabled veteran that has service-connected quadriplegia to be allowed to possess cannabis oil if that cannabis oil is recommended by her physician.
Do we, and let me say, I think the amendment that we put on the bill was suggested by, you recognized?
Representative Robin Smith, Representative, refresh my memory.
Okay, so let me go ahead
Darren
and take,
Jernigan,
let me go ahead and take questions about the bill.
Dr. Kumar.
Yeah. Let me go, Dr. Terry, you're recognized.
Thank you, Chairman. I just want to clarify, the amendment is not recommended by a physician. It's that the signed letter from the primary care or treating physician that attests that the patient has been diagnosed. So it's an attestation, and that's
correct.
what we need. Thank you.
And it's my understanding that Tennessee Medical Association has removed their objections to the bill as a result of this amendment.
Okay.
Is that a fair characterization? I don't want to overstate, but I don't want to understate. That they've removed their objections to the bill as a result of that.
And my understanding is that now this bill applies to service-related quadriplegia, and the patient has to have from their primary care physician a letter of you're recognized to tell what's required.
That this would be a benefit to the patient. And I'll defer to Darren Jernigan. Darren Jernigan have discussed this, and he certainly understands the impact of this more than most of us. 'Cause
Okay,
he's
but
had to,
I think we had another hand or two up, but if no objections, we'll go and recognize Chairman Jernigan, you're recognized.
Okay, thank you. Thank you, Chairman Wendell. Be happy to testify on quadriplegia, and I think a lot of, there are two types of quadriplegia. Obviously, one is neurological, the type that I possess, which you break your neck. Paraplegia, you break your back. And I can say neurological, this would apply, the diagnosis of quadriplegia, and I can tell you what I think the aspects of this type of oil would do for someone in my situation, especially in the evening times when I'm up all day long and I get really violent, hard muscle spasms. And I would love to be able to try something like this to see if it alleviate any kind of pain for me. Now, there's also what's called a traumatic injury with quadriplegia, where you lose your limbs. Now, neurologically, you still don't have access to all your limbs. People say, well, you move your arms. Like, well, yeah, I have biceps, but I don't have triceps. I don't have wrists. I don't have a lot of full function of my arms. But when you have a traumatic injury with quadriplegia and you lose your legs and your arms, and I'm blessed to have a neurological quadriplegia when it comes to especially someone that's lost all four of their limbs, and especially in the service of their country. And when you get to a situation where all medical science cannot help this person, but yet there is something out there that can medically help someone, recommended by a doctor, legal in another state to come here to be able to at least try it. It's what we owe a veteran that's lost their limbs for this country. It's what we owe a human being that's lost their limbs to be able to end some suffering and pain if this so does that. And it would be a travesty not to see something like this not pass out of this committee today. So I hope I answered your question, Chairman.
Yes, sir. Dr. Kumar, you're recognized.
Thank you, Mr. Chairman, and thank you, Chairman Jernigan, and thank you, Chairman Windle, for bringing this. I find this very appropriate and very meaningful to do this. One, it is a way we honor our veterans to do everything to make things comfortable for them, considering that this tragedy occurred when they were serving our country. Secondly, I find this justifiable based on the fact that quadriplegia or paraplegia with muscle spasms is a recognized indication approved by the FDA. Although FDA approved it in the synthetic form, but there are 4 indications that have been approved by the FDA, and those include nausea and vomiting of chemotherapy, muscle wasting and conditions related to AIDS, neuropathic pain, and muscle spasms. So I think we are on a scientific basis to recommend medical marijuana for this condition. We are not saying that it's on the internet. We are scientifically sound. Considering that and our commitment to our veterans, I think that will be good. My question to you was that you and I had discussed possibly adding paraplegia also. Did we choose not to, or?
You're recognized.
I had several discussions about broadening the scope of the bill, and the response of those discussions was that this bill would have a better chance if I did not broaden the scope, because there's certainly, from my perspective, a hesitancy to approve marijuana as a treatment for medical conditions in Tennessee. For whatever reason, and we can debate why that is, 40 to 44 jurisdictions have approved medical marijuana in some form in America. We're one of the last 4, 5, 6 states that have not approved. It was my judgment that if the bill is narrowly drawn to a member of our armed forces who is injured in the line of duty and cannot, I mean, I'll defer to Darren, but basically can't feel below their neck, and that individual would certainly not be a threat to abuse the product, or wouldn't be a threat to the public, that maybe we can ease into a discussion of the treatment, the humane treatment of individuals who have chronic and not just life-changing, but excruciating pain in many instances. And the individuals I talk to that are in this category have asked me to keep it narrow, to maybe get this through, and maybe they can set an example for other people that Tennesseans are responsible and are reasonable and are sober and will approach this in a manner where it's not frightening to the general public. Because apparently the general public's not frightened by it, but members of this General Assembly seem to be frightened by the concept of medical marijuana. But I can attest personally, where I'm from, that the opioid crisis has blown out. It's affected every family, including mine, and this is just the first step. And I'm not trying to throw the back across that, but hopefully if we keep this narrowly drawn, that we can have not a test case, but give an opportunity to show what the medical community as well as the clients that are treated by this can act responsibly, and it's a good program instead of something negative. Maybe a verbose response, but that's the best I can do.
Chair Lady Smith, I think you're recognized. You want to defer? Okay, Dr. Kumar, you're
No,
recognized.
thank you. I certainly respect the sponsor's explanation, and thank you for doing it again.
Thank you very much. And the reason I changed it partially was because of our conversation. I have everybody in the building respects your medical knowledge, and you're also a good guy. But when you said John Mark, you need to take a look at this because of this, then I listened to you and I followed your advice. And that's why the third part of that amendment's here is because you said you need to do this, and you're the expert, I'm not, so I took your advice, and that's why the bill is drafted as it is.
Thank you, sir.
Okay. Dr. Terry, you're recognized.
All right. Thank you. Again, I appreciate you bringing this bill, and to that point, if you had it more broad with paraplegia, I'm with you on that one as well. And to the chairman's point, muscle spasms and then phantom pain, the neuropathic pain from that, a lot of times opioids don't touch that, and people are on other medications for that, antidepressants, things like that, and this can help with their phantom pain. And if somebody has sacrificed for my liberty, I'm with you on this bill. So thank you for bringing this.
And let me make it clear, when you mention marijuana, what we're talking about is refined hemp oil.
Cannabis oil,
Yeah,
absolutely.
cannabis oil.
It's not smokable.
Right.
This is not a recreational
Topical
drug.
and- Yeah,
And
topical and oral, yes, sir.
But and again, this is not directed at your question, or not responsive to your
Yeah.
question, or in response. But I won't say it's farcical, but it's not reasonable to suggest that a quadriplegic is going to be causing problems as a result of receiving cannabis oil. I mean, to me, that's just not a valid argument. And maybe we can take the first step with this bill and give people a chance. Certainly our veterans deserve that, but also other people, through no fault of their own. If you're injured and have a life-changing injury, and there's a product that will but will take care of whatever issues you have, why should Robin Smith or Darren Jernigan or Pat Marsh say, no, you can't have that because my judgment's better than yours? I mean, if we're really, conservative may be a big net to throw, but isn't that a conservative approach to let people make their own decisions?
Representative Smith, Chair Lady Smith.
Thank you, Chairman, and thank you for bringing the bill, and thank you for working, because I agree with you. We do need a phased-in approach. I did have a question, though, because this is targeted to veterans who have been injured in a service-related injury. They are quadriplegic. What is the likelihood that that population is going to be treated by a physician or a caregiver in the space of the Veterans Administration? And I'd like to follow up if I could, Mr. Chairman.
100%.
Thank you, Mr. Chairman.
ready,
And the reason I want to point that out is, Dr. Kumar has brought a resolution. We're all waiting for our federal government to move this from a class 1 to some other class so it can be studied. But I think that this is a construct that would help facilitate a very live sample it's a confined healthcare population. It's being seen in a confined healthcare service arena. And I think that you're doing a great service, not just for the patients which need this, but also the fact that this can set up a sample that can be studied very efficiently. So again, thank you. I'll be voting in the affirmative.
And I appreciate it. If I could respond to that.
Yes, you're recognized.
I'm not here to push any drug. I mean, that's something I don't have the expertise to do. But I can assure you there's a whole generation of young Tennesseans that want the same opportunity that young Israelis have now, that young Canadians have now, that young Australians have now to grow and produce a crop and a product to sell to the world. I mean, we've been selling Jack Daniels across the world for the last 200 years, and it's not legal there, or it hadn't been legal there. So when somebody walks up to me in Jamestown, Tennessee, and says, John Mark, why can't I sell a product to Israel or to France or to another country because I happen to be very good at it, or theoretically they're good at it. Why would they not be able to sell that product worldwide when it's legal somewhere else? I mean, alcohol wasn't legal here, and it was produced here. So I could take that argument one step further and say we should be allowing young Tennesseans who want to work every day, want to produce a product, to let them do that. But that's another discussion for another day, I guess.
And Chairman Marsh, I think you're asked to be recognized.
Thank you, Mr. Chairman. And Chairman Wendell, I just have a small question. How will this oil be received in Tennessee? How can this person receive the oil?
the oil had to be purchased in a jurisdiction where it is legal, which is 90% of America now. 90% of Americans have access to it. So you'll have to go to a jurisdiction where it is legal to purchase this item, and this will be a defense to the illegal possession of it in Tennessee.
And you send, pardon me for interrupting, but you send the money to that state, and then actually a large part of it comes through the Postal Service.
Thank you.
Have further comments or questions? I did have a request for input from the Department of Health and also the Department of Safety. Did anybody want to come forward and speak? I see Department of Health. We'll go out of session if there are no objections and recognize go ahead and identify yourselves.
Patrick Powell from the Office of Legislative Affairs at the Department of Health. With me is Dr. Tim Jones, our Chief Medical Officer. Happy to answer any questions or express the department's concerns with the bill.
I'll just give you 3 minutes here to go ahead and express your concerns, and if we have questions, we'll take care of those.
And I will actually defer to Dr. Jones, as he will be much more versed in that than I will.
Good morning. You've already heard a lot of good data and information. I will just remind people that this is essentially pure THC oil. It's really, really different from CBD. Concentrations can be from 40 to 80% THC. It causes all of the same psychologic and not symptoms, effects that smoking marijuana and other forms of THC does. Because this is not an FDA regulated product and the concentrations of THC are so high, I think it's very easy for users not to know precisely how much to take and potentially have errors there. There's been discussion about smoking. It can be vaporized. Now that may not be the way it's prescribed, but that's not an uncommon way to take it in places, in people who do. There was some discussion about, starting with a very, very limited population, which this is. I would say that the population to which this would currently apply really does not represent at all the wider population in terms of learning from the experience in this small population and then opening it up to more and more people with similar conditions. I mean, it would be very, very different. Obviously, there are a lot of philosophical arguments and things that you all would need to consider, but this essentially opens up medical marijuana THC, to potentially a much, much wider population, and you all know how difficult it has been to define the patient population and limit it to a very long list of other conditions.
I'll recognize Chairman Jernigan.
Okay. Thank you, Chairman. I just have a question for either one of you. Do either one of you know a person that's 100% connected with quadriplegia? Either you know a family member or know somebody?
No.
No, sir.
Okay. Thank you very much.
I think Representative Freeman, you're recognized.
Thank you. You mentioned that they can get anywhere from 40 to 80% THC in the oil, and let's say they get 80 instead of the 40. What would happen? What's the outcome?
It depends very much on the person, how much they've taken in the past, and therefore sort of built up susceptibility. Overdose can lead to severe confusion. It can exacerbate psychologic conditions. Some people do end up in the emergency room, with, I think, the adverse effects of psychiatric conditions. Those are really the primary things.
You're recognized.
And how are so today, what are they treated with? Do you know?
These patients, you've heard a little bit, but probably opioids would be the step before they would get the last step before they would be prescribed this.
And the outcome of taking too many opioids?
Again, in all of this, obviously also is, and you've heard before, folks that are quadriplegic are going to be much less susceptible to causing others harm. But opioids, clearly, overdose can lead to same thing, loss of consciousness, death.
Death.
Which THC does not very often. So that's important.
THC does not end in death.
Very, very.
Thank you.
Essentially, no.
Further comments or questions of our witness? If not, we appreciate, and I was notified that we need to have the doctor introduce himself once again.
I apologize. It's Dr. Tim Jones. I'm the Chief Medical Officer, Department of Health.
Okay. Thank you very much. And no objections. We'll hear from the Department of Safety. You're recognized. Go ahead and introduce yourselves.
Elizabeth Stroker, Legislative Director for the department, and I'm going to let Colonel do most of the talking. I think this is his first time testifying in committee as the Colonel, so I'll turn it over to him.
You're recognized, sir.
Thanks, Chairman Ramsey. Committee, we appreciate the time to come in and speak, and we won't take too much of it. Certainly, we understand where Chairman Wendell is coming from with this bill and understand that. Our biggest concern is the potentially unregulated amount of THC oil, the concentration, the fact that it's still federally illegal. It's not processed in Tennessee, so we're worried about it being transported across state lines through the state as well, unregulated, how we handle that, and certainly impaired driving. I know y'all have heard THP talk about it for years. Impaired driving, most of the states that have legalized it in some form or fashion have seen an increase in positive marijuana testing from drivers. So that's some of our biggest concerns.
We have questions or comments. If none, we appreciate your testimony. And thank you very much for being here.
Thank you.
Thank you for the job you do. We appreciate you every day.
Thanks, Chairman.
So no objections. We'll go back into session, and Mr. Sponsor, you're recognized. Or do anybody have any other questions? If not, we will be voting to send this bill to full committee as amended. All those in favor say aye. Aye. All those opposed? So approved.
Thank you, Mr. Chairman.
And thank you, sir.
All right, that brings us to item number 8, House Bill 239 by Chairman Ramsey. You are recognized. You have a motion and a second.
And thank you, Mr. Chairman. This essentially is a very, very similar bill to what we've just heard, and I may give a little bit more information. This is a bill similar to the Chairman Wendell's bill to frame the importance of an issue that too many times has been obscured by the general publicity of illegal drugs lumped under criminal codes. And this is kind of a family issue for us. We certainly have seen lots of witnesses up here that are in really difficult health situations because of life-threatening diseases. That's what this bill is about. Corey Gunnels, who is a citizen here in Tennessee, he's 43 years old, has 2 children, a wife, and a father, Doug Gunnels, that I think has contacted many of you, who's a liaison with the Department of Transportation. And I won't get into all the particulars, but I will say that for 10 years, Corey has battled neuroendocrine carcinoma, which was found by just a random CT scan after an accident. He had surgery, 3 cycles of chemotherapy, 35 radiations. This is a disease that has a 5-year survival rate of about 50%, so it's a very serious condition. He went 4 years clean without anything. The tumors came back. He received further targeted therapy with therapy and hormones, which shrank for a short period of time. In 2017, new tumors came back, and one blocked his vena cava 90%. He had a stent at Vanderbilt to open that. For 5 months, he had growth even under chemotherapy. The new medication, Lutathera, was given, and he did fairly well for a short time. But in effect, the condition deteriorated even with radiographic infusions, pressure on his vocal cords. The tumors are proliferating in his extremities. He spoke to a friend of a friend with anecdotal evidence of what's called Rick Simpson oil. And that's what this bill addresses here. As the previous sponsor mentioned, he did not draw a specific mixture or percentage of THC, and we did neither. The Rick Simpson oil is a general label for different substances. He went online, and we talked about the limited access of results and maybe assessing the effectiveness of these products. And online, he found 40,000 members of Facebook programs, some of them that had his own disease and many that had others, that had some amount of success, and some with the neuroendocrine cancer itself. Immediately on beginning the oil, of course, he had some stability of O2 and blood pressure and heart rate, and some cessation of the pain, extremity pain, neck pain, the tumor shrinking in half. And for the first time in 3 years, he had some loss of the size of the tumors. And what we're assessing today is when measures cease to improve, or even actually in his case jeopardize his remaining quality of life. Thank goodness we're not the ones that have to tell him that we've done all we can. But I do know that we're all sensitive to that, because in 2015, we passed a Right to Try Act, which indemnifies licensed health providers solely for the recommending of to eligible patients regarding the access of treatment with investigational drugs or biological products. And in 2014 and 15, we passed the possession of THC oil, which there again was considered at the time to be illegal. What this bill does is got an amendment from the Tennessee Medical Association, as the other bill did. What they require is it gives the right to possess oil in Tennessee, the Rick Simpson oil.
Chairman,
Yes,
let me interrupt
yes,
you for a second. You did mention amendment, and before we talk on that amendment, let's get a motion and a second. Okay, it's amendment 004132, is that correct?
Correct, that's the one.
Okay, so we're on the amendment. If you would like to speak on the amendment, please go ahead.
And what this amendment does, it makes the bill. It requires a letter from a patient's primary care physician diagnosed with life-threatening cancer, that has been attested to of a licensed cancer center that's rated or recognized. Second item that it has is it attests that the patient received conventional methods of treatment which have failed, and it is signed and dated by a physician for a period of no longer than a year. It also requires proof that the oil was purchased where RSO is lawful. And as I say, Rick Simpson oil is not a specific oil. It's a family of full cannabis extracts that is, as one of our witnesses said, can vary. But in states that it's legal, the amounts of different distillates in it are listed, so you know what you're getting. It's not you just buy a random sample. It's tested by the states where these are legal. So this bill really is for the situation where we're addressing measures when we cease to improve the situation that people are in. We're in that particular amount of time when the months, days, and years that can go in between constructive treatment and actually the resolution of the situation. And when I say resolution, I don't mean cure. The hope is that there will be benefits up until that point. So with that, I'll stand for any questions. If you have any questions on the issue, I think we discussed the other one very well, but be glad to speak about what I've found out.
Okay, do we have questions on the amendment or on the bill? Chairman Kumar, on the amendment?
I did not differentiate. I think it basically makes the bill, does not?
It does.
Okay, yes.
Okay,
Yeah,
on the bill or on the amendment? You want to speak on the bill or the amendment?
I'll speak on the amendment.
Okay, you're recognized.
Thank you. Thank you, Mr. Chairman, for bringing this. A few things to correct. What we approved several years ago here was CBD oil, not THC oil.
Oh, yes, sir.
Okay. Secondly, mailing THC products is by law illegal because U.S. Postal Service is a branch or entity under the jurisdiction of the federal government. So, or other mail carriers also, UPS, FedEx, and so on. That is illegal, but issues surrounding marijuana and THC have become very murky about what's legal and what's not. What's legal in one state is not legal in other states, and that's unfair and inconsistent. Want to make clear that we are not in any way implying that THC cures cancer.
Yes. Yeah,
You're recognized.
Yes, certainly, and the resolution of situations like this is I don't think the expectation is even that there will be a miraculous recovery of even a percentage of the original health status. But, and somebody actually said, why would you give these folks false hope? And I didn't know that there was such a thing as false hope. And so as this young man went online and found 40,000 other people that were searching this issue, I feel like that's pretty strong grounds, the fact that this does give hope to people. And I would never want to extend, and that's why the Tennessee Medical Association wanted to separate the medical practice from having to make recommendations or having to give information, because the understanding is that no, this is not a cure.
Chairman Kumar.
Thank you for explaining that. I think it's also very important to realize that this bill addresses advanced cancer. and not just cancer, because we see marijuana bills that come through, they try to add every condition that might have been mentioned as possibly benefiting from marijuana on the internet. But you're dealing with advanced cancer, and I think that's well defined. And there is a sense of comfort when people are suffering to that degree and they find, as you say, hope. And you explained it to me that hope can also be a placebo. And I think considering that, it's a reasonable thing to do, that we are confining it to advanced cancer. We are not giving people false hope about cure. The only other concern will be it is RSO, or particular branch specific. And I don't know if legally that's good or not, but it's your pleasure, it's your bill. Thank you, Mr. Chairman.
Chairman, any comments on that?
Well, just to make a comment, as I say, the Rick Simpson oil is not a specific brand. It was generally applied to a large array of cannabis distillates, and so that's essentially what we're looking at here. So it in the vernacular and the atmosphere of cannabis products, it is considered a distillate, and it comes in particular percentages of THC, and that's all established in the states.
And to your point, Chairman, subsection C says, for purposes of this section, RSO oil means, and we have it defined there, full extract cannabis oil containing THC that is intended for the use ingested orally. So we do have it defined in here. Any further questions on the amendment? Okay, seeing none, we are going to vote on amendment 004132. All those in favor say aye.
Aye.
Opposed? Ayes have it. We are back on the bill as amended. Representative Smith, you recognize.
Thank you, Chairman, and thank you, Chairman Ramsey. I do have a couple of questions, and Dr. Kumar referenced the advanced. How is advanced cancer defined in your bill?
I don't think the term was advanced cancer. I think the term was life-threatening cancer, which I guess would have to be a determination of the rated or recognized licensed cancer center, and so I think the physician is allowed to designate that, but the TMA wanted to make sure that the responsibility didn't fall on the physician to recommend or to counsel on potential usage. So I think that's pretty much what it would have to be, a life-threatening cancer from that was designated such and could be put on paper by that recognized cancer center.
Okay. Representative Smith?
I do have a couple of follow-ups, because I want to support your bill, I really do, but I also know that, I'm sitting here and I'm terminal. Every one of us has a terminal disorder. And so I'm concerned just from the perspective of, Volkswagen is in my district. And as they have people standing on their multi-million-dollar assembly lines, most likely someone, unfortunately, is struggling with a type of cancer. And what liabilities are transferred. And so I'm trying to understand exactly, what this patient might look like clinically. Would they be working? Would they not be working? Would they be driving? What levels of THC could they potentially absorb? And these are the questions I know that you don't have the answers to, but to the degree that we can, what I don't want to do is create unintended consequences by law that transfers liability onto an employer that they can't do anything about. And so that's a concern, and I'll let you answer that, but if I might, Mr. Chairman, follow up. On the RSO oil, is there anything that fixes this definition in a static way so that there are not other solutions that could change their ingredients to meet this, but not really? Because, when I first read RSO oil, I thought, is that Robin Smith oil? Is that, what is that? I want to understand, because when everything is RSO oil, then nothing is RSO oil. And so I'm trying to understand, just for the purpose of putting this in code and making sure that we have, that we treat this as the serious treatment that it is. Thank you, Mr. Chairman.
Chairman, you recognize.
Essentially, the same definition exists here for RSO oil as exists in the previous bill. Cannabis, I think the term was let's see, how'd they put it? Full extract cannabis oil. Now, the gentleman that first started making this popular in the 70s was named Rick Simpson. And so Rick Simpson distilled this oil down and sold it or gave it to people for medicinal purposes. And so ever since then, the general definition has been full extract cannabis oil. And of course, it does come in different percentages. And the previous sponsor had to face the same issue in writing his bill as I did, that if you put down a specific percentage, then you're going to be way off. So he described his as full extract cannabis oil, which is the definition of Rick Simpson oil. And so we wanted to be specific about a type of extract cannabis oil, and nobody sells, even Rick Simpson doesn't sell Rick Simpson oil, but it's considered a process. So what these people do, they get on Facebook, they decide what kind of specific percentage they want to try, and see how it's worked for somebody else. So they order from a legal state, they order a Rick Simpson type extract oil that has that percentage in it. And that's kind of how they determine the dosage and the usage. And as we heard from the Department of Health, it's very rare, and I don't know if it even happens, that an overdose of cannabis material causes death. Causes some issues, but he said death wasn't typically one of them. So that's pretty much the reason we came up with that definition.
To follow up on her point, and one of the questions that she asked about Volkswagen and impairment, we have laws against driving while impaired. Yeah. There are drug tests that can be done for that. And as far as workplace, we have the drug-free workplace program, and employers can do that. Currently, it's essentially a plus or minus. You either test positive for THC or you don't. In a couple weeks, we may have a bill in this committee that defines that test a little bit more specific to determine if someone's impaired or not. But we do have that's out there.
And let me say, let me just describe this young man's situation. He, of course, went through all these treatments, and that's what this is for, somebody that's gone through treatment that no longer is successful. Well, he long ago had lost his job. They couldn't keep him on because of the extreme side effects that these strange and mysterious chemotherapy programs they tried, and so I don't know that he's had a driver's license for a long time, but right now he's struggling for his life and has been for several months, and I think typically the people that are in this kind of situation have long ceased to be able to function at a job or in any other place. So that I'm going by this one as having received treatment which no longer works, and I think that's the intent of the bill.
Okay. Sure. Representative Smith, you recognize?
Thank you, Chairman, and thank you, and please hear me. I mean, I understand. I've seen terminal cancer. I think most of us have family members. I'm trying to make sure that, in our green books and our Tennessee Code annotated, we have specific definitions of practicing medicine. And while I hear that the TMA does not want the responsibility of making this determination whether this works or not, we're essentially saying it's up to word of mouth whether someone uses something that in the federal law is deemed illegal. And I want to make sure that we're not constructing a precarious situation unintentionally. I want to vote for your bill. I'm not going to oppose your bill, let's put it this way. I just have some deep concerns that it's so subjective, very subjective, that we may be putting a bill in code, letting something happen where there are some really sick people that are hurting. Don't disagree with that. I've given Marinol. I mean, I've given medical marijuana. But I also know that there are more effective, diluents and solutions. So my concern, I just want to go on the record to say, we need the U.S. Congress to move this to a class that can be studied. And I think that we need to follow this very carefully and make sure that we're quick to amend things if we find that it's too broad. But thank you so much, Dr. Ramsey.
All right, thank you. While we're here on the bill as amended, we do have the Department of Health and Department of Safety, again, have asked to speak on this. And I don't know if, I'll go ahead and recognize the Department of Safety. So without objection, we will go out of session. And for the record, again, state your name and who you're with.
Thank you, Chairman. Elizabeth Stroker, Legislative Director, and thank you to the Chairman and the sponsor as well. I think everyone kind of knows where law enforcement is coming from, and we do get what everyone is saying. And so I'll kind of let the Colonel reiterate what we talked about on the last bill, but really kind of for the most part, again, is that it's still an illegal substance, and it doesn't say you can't drive while you are taking it, even though someone may not be able to drive. And so there is that concern that someone may not know that it may impair them driving. And so I'll let the Colonel kind of clarify more on that, but it really is the same concerns as with the last bill as well.
Thanks, Elizabeth. Chairman, Colonel Matt Perry, Tennessee Highway Patrol. Again, we completely understand the purpose, sponsor, Chairman, and our biggest concern is impaired driving, the unregulated use, the illegal use of anything that becomes legal is illegally used and abused, and that's our biggest concern. And impaired driving, a lot of people don't know that, you take the prescribed amount of any narcotic or a scheduled drug or an opioid, it impairs you. People think, well, a doctor's prescribed that, I can use that and still drive a car. So our biggest concern is always going to be safety and to the driver, to the citizens of Tennessee, and impaired driving. Thank you.
Okay. Any questions? Chairman Jernigan, you're recognized.
Is it on? It's red. Okay. You're messing with my mic over there, Chairman. So, my question is, this passes, and you stumble on someone who possesses this drug. Do you going to follow state law, or are you going to follow federal law?
Chairman, we'll follow the state law.
Okay. Thank you, sir.
Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. I hesitate, but it has to be brought up. The concern about diversion. It applies to the previous bill also, especially in the previous bill, a quadriplegic person, somebody has to handle it for them. And I guess you depend on the honesty of that person. But diversion is a concern, is it?
You're recognized.
Yes, Chairman, it is a concern. Obviously, the illegal use of a legal drug is always a concern.
Yeah. No.
Chairman Kumar?
Thank you,
Thank you.
Mr. Chairman.
Okay, any further questions? Okay. Seeing none, thank you. Appreciate you testifying. With that, we'll have Department of Health come up. And again, for the record, state your name and who you're with.
Thank you, Chairman. Patrick Powell with the Department of Health, and again, Chief Medical Officer Dr. Tim Jones. The department is opposed to this bill, much like the last bill. We've kind of drawn our line in the sand at, substances that have been approved and gone through the safety and efficacy processes of the FDA. Obviously, this still has the same concerns as the last products or the last bill, wide-ranging THC amounts that are not able to be kind of adequately monitored for dosage, and this is for cancer, which is not an approved treatment, I believe. I'll let Dr. Jones expound.
Sorry, the only thing I'll add to what I said before is this question about life-threatening cancer. Just to emphasize that that does not mean terminal cancer. I mean, most cancers are life-threatening but can be treated. I mean, in my office, there's a person with breast cancer, a person with colon cancer. Both are very unlikely to kill them. They're functional. They drove to work. So, you know, based on that, you're talking about with that definition, you're talking about a very, very large group of people. All of us know people who would qualify by that definition. And obviously, the wider the group that can obtain it, the higher risk of diversion, as was mentioned a moment ago.
Okay. Any questions? Representative Kumar, Chairman Kumar, you're recognized.
Thank you. Thank you, Dr. Jones. I think you raise a very important point that I've been thinking and Chairman Smith's been thinking, that is, every cancer can be life-threatening. So just saying life-threatening is not enough, and I thought it did say advanced, but it does not. If we wanted to help people who have certain symptoms that are not being relieved by conventional medicines and do have advanced cancer, I don't know, it doesn't have to be stage 4, it can be stage 3 and disabling and so on. Kindly give us an opinion if you feel at liberty to do so legally. And secondly, you're not going to tell us what we need to put in. Okay.
You're recognized.
I've been thinking about the same question, and I have no idea how I would define advanced. There are so many different kinds of cancer and different ways of rating them. You know, there is no line in the sand, so it would very much be a judgment call to say one is advanced, one's not. I would not know how to write that into a bill.
Thank you, Mr. Chairman.
Okay. Any further questions while we have them up here? I do have a question for clarification. You talked about fully proven, and you drawing the line in the sand for fully proven FDA medicines. Can you?
And I was just saying that generally our stance has been on THC and marijuana that we would like things to go through the FDA safety and efficacy processes. Obviously, with Rick Simpson oil, in this case, that is not the case. It hasn't been granted an emergency use authorization. It hasn't been given an approval by the FDA. And so it is a largely unknown and obviously still illegal on the federal, as safety brought up, product that would be being offered as medicine and in wide-ranging THC amounts that really have no known dosage, considering the range that a non-regulated THC product could have on this.
Okay, to follow up on that, any medication, we passed right to try a few years ago, or any medication that's in potentially research or anything like that, that obviously is not fully FDA approved, but you're not drawing a line of sand on Tennesseans not utilizing those medicines.
This is specific to an already illegal substance that has not been approved. So we're only speaking on the THC and cannabis, excuse me.
All right, any further questions while we are out? Chairman Kumar?
I'd like to clarify that right to try applies to medications that are in trials under FDA supervision.
Correct.
It does not apply here.
Thank you. I'm just trying to get you guys on record. Thank you. Any further questions while we're out of session? Okay. Seeing none, thank you for your testimony. We are back in session. Chairman Ramsey, you're recognized.
And let me say that the requirements on this bill, as I'd mentioned, is a person that's been diagnosed with life-threatening cancer and has received conventional methods of treatment which have failed, and those conventional methods of treatment can be Marinol. So we're talking about the end of the road here. And it's fairly well stated, and they have to have this in their possession.
Any further questions? Okay, seeing none, we are voting on House Bill 0239. All those in favor say aye. Aye. Opposed? Ayes have it. Bill moves on to full committee.
Thank you, ladies and gentlemen. We, Chairman Vaughn, you're recognized. I think we have House Bill 1350, item 2 that we rolled. You're recognized. Have a proper motion and second.
Good afternoon, committee. What I'm bringing to you today is a classic case of trained professionals who do good things for people having a disagreement. And what they're disagreeing upon is the use of the term anesthesiologist. To quote my good friend from Chattanooga, to paraphrase it, if everyone calls themselves an anesthesiologist, no one's an anesthesiologist. And so what this is looking to do is to provide parameters around that term. I myself, I'm an engineer. I have a license from the state of Tennessee. I'm graduated from a 4-year ABET accredited school, and used to, engineers were, the term engineer in a profession was limited to someone who met those qualifications. You find a network engineer, you can find a change engineer, you can find a social engineer. Everybody has stolen that and watered down that term to where really what is an engineer other than some type of generic problem solver. That's really what it's turned out to be. In this case, it stems from a disagreement between professions, between the medical and dental profession. It's brought to light in 2020 when our Board of Dentistry adopted rules officially recognizing the dental anesthesiologists, and the Tennessee Society of Anesthesiologists, or the medical anesthesiologists, took exception to that. This is a conversation and discussion and disagreement that's taking place all across the U.S. Got word this past week that the New Hampshire Supreme Court decided in favor of anesthesiologists being a medical field profession, and I know that that's not here. But at the same time, it does show that people who have been looking at this agree that there is a distinct difference. And so today, we're asking for y'all to clarify, to allow this bill to clarify the difference between the two. And I know that y'all have been on some pretty heavy subjects. This is very important to the people who practice this profession. I am glad to say it's not life and death. It can be life and death. And there's plenty of good people who administer anesthesia. Whenever I had my colonoscopy, or I had another treatment, I was glad that I didn't ask what their professional designation was. I was trusting that they were qualified. But in the realm of professional accreditation, it does matter. And so that's what we're here to submit to you, and I know that we've got people who are willing to, who would like to speak to this.
Okay, thank you for that explanation. And I think maybe there had been discussion earlier in the year to try to work this out with compromises, which didn't go anywhere. And so I think this is something we need to look at. Have any questions of the sponsor from the members before we go out of session and hear from the expert witness? Yes, sir.
Yes, sir. I would like to clarify. Although I'm not an anesthesiologist, I was pre-med for 1 semester. So it does allow me to speak to this with some certainty.
Well, sir, sometimes you put me to sleep. So any? Okay, if not, we'll go out of session, and I think we'll recognize Dr. Chris Young. If you want to speak, we'll go 1, 2, 3 here, 3 minutes, and then we'll have period for questions.
Thank you, Mr. Chairman, for the opportunity to address the committee today on this important legislation. My name is Chris Young, and I'm here today representing 9,000 members of the Tennessee Medical Association and over the 600 anesthesiologist members of the Tennessee Society of Anesthesiologists. I'm a practicing anesthesiologist in Chattanooga, and I've provided clinical anesthesia instruction to residents and student nurse anesthetists for 32 years. In addition to my clinical anesthesia practice, I currently serve as the Chief of Staff of Erlanger Health Systems. At this moment, all across the state, hundreds of patients are in pre-op areas waiting for surgery. They are understandably concerned about their surgical procedure, but many times are even more worried about going to sleep. In most cases, patients are relieved and reassured when they meet their anesthesia care team, a highly trained, certified, registered nurse anesthetist, and the physician ultimately responsible for their anesthesia care, their anesthesiologist. The Tennessee Medical Association and the Tennessee Society of Anesthesiologists have enormous respect for the profession of dentistry. Dentists have earned that respect through long years of education, training, and experience, and an ongoing commitment to patient care. Inherent in the relationship between physicians or dentists and their patients is a clear understanding by the patient of their professional qualifications. Patients have the right not to be confused about who is providing their care or their level of training. Last November, the Tennessee Board of Dentistry voted to add a new dental specialty certification for individuals wishing to practice dentistry under the title dental anesthesiologist. This designation is in conflict with the term anesthesiologist, clearly defined by the General Assembly for many years in the Tennessee Code, and has thus created a conflict in the law. House Bill 1350 seeks to address and remedy this conflict. The bill does not in any way restrict the practice of dentistry or the ability of the Board of Dentistry to issue permits for dentists administering anesthesia in dental offices. In the healthcare setting, the term anesthesiologist has a specific meaning: a physician who has successfully completed the education and training needed to specialize in the entire field of anesthesiology. Anesthesiology is far more than just the administration of anesthesia. In addition to providing care for patients undergoing anesthesia, anesthesiology encompasses the entire science and medicine related to the clinical basis of anesthesia care, resuscitation, critical care, and the management of acute and chronic pain. Anesthesiologists are the undisputed experts in perioperative medicine, not just the administration of anesthesia during surgery. To become an anesthesiologist, an individual must first obtain a bachelor's degree for which must include a year of biology, physics, general chemistry, and organic chemistry. The individual must successfully complete medical school and obtain a medical doctor and obtain a degree as a medical doctor or a doctor of osteopathic medicine. Following medical school, the individual must complete a one-year internship, usually in medicine or surgery. During this year, newly graduated physicians use their medical school experience in the hospital environment to solidify their ability to accurately diagnose and treat patients.
Go ahead and finish up there if you would, sir.
Following the internship, they do 3 years of anesthesiology with a complete in the entire specialty of anesthesia. There's a total of 12 years of education and 16,000 hours eligible to become eligible for written boards. They are accredited by the American Board of Anesthesiology, which is the standard for admission to a medical staff in a hospital. In comparison to the education and training of physicians and dentists, they're similar in the respects of undergraduate education, but dental school curriculums and medical school curriculums are very different. Dental school concentrates on subjects commonly associated with dentistry as dental and oral boards, dental education with minimal exposure to the diagnosis and treatment of patients in need of critical emergency care, commonly associated with anesthesiologists.
Yes, Dr. Young. Let me open it up for questions. Do we have questions of our expert testimony? Dr. Terry, you're recognized.
Thank you, Chairman. And you mentioned anesthesiologists where we already have anesthesiologists defined in the code, correct? And it's defined as a physician who is, it's in the Medical Practice Act. And so it's a physician who's completed residency in anesthesiology. So that's already there. And so when you say the word anesthesiologist, it is a medical doctor. It's in the Medical Practice Act. Is that correct?
Correct.
And so it is someone that has gone to college, they've gone to medical school, and then they have completed their anesthesiology residency, correct?
Correct.
And so when you put a qualifier, if you use the term anesthesiologist, that's what that means. When you put a qualifier on front of that, that means more training, correct?
Correct.
So the Board of Anesthesia and American Society of Anesthesiologists recognizes several fellowships.
Correct.
Obstetric anesthesiologist, pediatric anesthesiologist. I cannot find anywhere where the ASA recognizes, in the United States or Canada, where there's a program where they recognize a dental anesthesiologist. It's not one of the programs that they recognize. Is that correct?
There has been a reference in one publication where they referenced the American Society of Dental Anesthesiology, but those programs are not considered in terms of qualifications for anesthesia training in a hospital or in a hospital, certainly in Tennessee, because they must be board certified by the American Board of Medical Specialties.
Okay. All right. Thank you. So it qualifies as more training, is what you're saying. We have obstetric anesthesia.
Excuse me, but when you use a modifier, that implies that the physician has had additional training, like a fellowship. Dental anesthesiologists in Tennessee, is defined by the dental board, require only 2 years of postgraduate training after their dental school. So there's a substantial. It's the only modifier that implies less training rather than more training.
All right. Thank you.
Dr. Terry, Chair Lady Smith, you're recognized.
Thank you, Mr. Chairman, and thank you, Dr. Young. One question, because I know that the term anesthesiology is a very broad term, and as I want to just hear for the record, is it anesthesiologist that is defined in Tennessee Code Annotated?
Correct.
So just for the record, because one of the things I learned as being a UT grad, I'm a volunteer because I graduated from the University of Tennessee, but I also volunteer almost daily, whether it's at my church and other things. So one of the things that if you could speak to, the purpose of this bill is to limit the term anesthesiologist and not the term anesthesiology. And I know that's a very vague thing, but one of the things I've heard from other specialists is they're concerned about putting a box around the term anesthesiology, the study of anesthesia, as opposed to the application in the practice use. And if that's something that we need to get legal to expand on, happy to do that. But thank you, Dr. Young.
No, this bill specifically refers to the individual calling themselves an anesthesiologist. And if I can, the dental board issues permits for anesthesia care in a dental office. They require 1 year of additional training after dental school to perform general anesthesia in an office. What the dental board voted for was to recognize dental anesthesiologists, which require 2 years of postgraduate training. Now, a dentist may also employ an anesthesiologist from a hospital with much more training also to work in an office. So you can see how patients might confuse the two, because there could be two different people referred to as anesthesiologists even working in the same office with vastly different levels of experience.
Further questions? Yes, Chairman Boyd, you're recognized.
Thank you. Thank you, Mr. Chairman, and appreciate you coming to testify today. As I listen to this and I think of the word anesthesiologist, and that right now the dental anesthesiologists are recognized. I kind of, in my opinion, the adding the word dental to it should be distinction enough. I mean, I don't, in my opinion, I'm not sure that somebody's going to get confused between the two. I would never have a surgery and ask a dental anesthesiologist to come perform the anesthesia for it. And so I'm just, there's a lot of words out there, just like Chairman Vaughn mentioned, the word engineer. I mean, it has many different applications, and even the word doctor can be used in many different settings. But, I've never confused someone, a doctor of education, with someone who is a physician, who is what most people refer to when they use the word doctor. And as I listen to this, it seems like there's an obvious compromise to this, and that is just allow there to be dental anesthesiologist, and then the word anesthesiologist without the word dental applies to everyone else, like Dr. Terry behind me here.
You're recognized? Yes, sir.
We have dealt with transparency of healthcare professionals for many years in Tennessee. In fact, have passed laws that actually require both physicians to display exactly what their degree is on a name badge in a hospital, because it has become so confusing. So I think if you are a patient or a parent of a patient who's coming into a dental office and they heard the word anesthesiologist, they will associate that with the anesthesiologist that they are familiar with, someone who's put them to sleep in a hospital before or helped them with an epidural or a C-section, things that people commonly associate with the anesthesiologist. The idea that a dental anesthesiologist presents their name in an office, I think, would be very confusing to them, and would be surprised to know that they're not a medical doctor.
Chairman Boyd, we have Chairman Marsh.
Thank you, Mr. Chairman, and I'd like to ask you a small question. Does this proposed legislation, could it impact other professions such as veterinarians? If you have a veterinarian who's an anesthesiologist.
As far as I'm concerned, we are concerned about patient confusion in a dental office. This really, if there's a concern with the veterinarians, I think we can.
Doesn't have anything. Okay, I just want to make that clear. Thank you.
If further comments or questions of our Dr. Young? If none, thank you, Dr. Young.
Thank you, Mr. Chairman.
And I'm told that we're going to be so short on time that we're probably going to have to adjourn. We have at least 4 other folks to give testimony. I'm very sorry. I know some of you have come a distance and made plans for this. So we will go back in session, and the chair will stand for a motion to adjourn. So have a motion to adjourn. All those in favor say aye. Any opposition? We'll adjourn, and we will take this up next week. It's probably a good thing. I'm glad they brought up that.